Hey, today's video is going to be all about, is your Medicare supplement, your Medigap Plan F going away? And if you're on a Plan F, do you get to be able to keep it? There's some regulations and rules that are changing. Maybe you don't know about them. If you have not been informed properly, you're probably thinking it's going to be going away. If you are in that situation, stick around. I'm going to explain how Medicare supplement plans work and the Plan F, is it really going away? Hey, a lot of times people get very confused on Medigap or Medicare Supplement Plan Fs when it comes to when exactly did they stop being eligible to enroll into Plan F. If you have a Medicare Plan F, can you stay on the Plan F? Is that Plan F actually gone away? What is exactly happening in the Medicare space altogether when it comes to Medicare supplement plans? And often I talk to people that have talked to agents that are well intended to guide them through the process properly, and find out that they have not been guided through the process correctly and explained how a Medigap policy works. So one, I would encourage you, if you're talking to a licensed agent and it's outside of us, to make sure that person actually knows how to write a Medicare supplement or a Medigap policy. If they've never written one before and you're the guinea pig, you're probably going to find that that person is not very educated when it comes to Medigap and Medicare supplement products. So Medigap and Medicare supplements mean the same thing. I call them Medicare supplements. So for this video purpose, just understand if I'm saying Medicare supplements, we're talking about Medigap. So one, getting someone that has enrolled people into Medicare Advantage, Medicare supplements, and prescription drug plans that have a holistic view of Medicare health plan options is very important. As an insurance brokerage, we specialize in Medicare health plans. That means we specialize in any and all types of different health plan options. So finding that out first is very important for you to eliminate some of these complicated situations you get yourself into by being guided by somebody that is predominantly bent towards enrolling you into a Medicare Advantage plan. So one, the Plan F has not gone away. Now there are some rules and regulations around the Plan F, and it regulates who can enroll into a Plan F right now moving forward and who is qualified to be able to stay on their Plan F. Previously, if you've been on a Medicare Supplement Plan F, you probably know this, but if you have family members that are on it, maybe you think, hey, do they still have insurance? Do they not have insurance? Legislation was passed. What does that actually mean? We're going to dive into that. That's the main crux of what this video is all about. Give me just a second. I'll be right back. So what caused some of this change is called MACRA, that happened back in 2015. The actual definition of MACRA is Medicare's Access and Chip Reauthorization Act of 2015. And what exactly happened during MACRA, and then how did it roll out in January 1st of 2020? So what MACRA basically did was, as of January 1st of 2020 and beyond, anyone that was turning 65 years of age, MACRA eliminated the deductible for Part B from being able to be paid by Medicare supplement plans. So how did that affect Medicare supplement plans? Well, a Plan F would cover 100% of everything for Part A deductibles, and then Part B deductibles, and then the 20% billable rate of the billable item for Part B services. So if you went to the doctor, you'd pay a Part B deductible first, and then if you went back to the doctor, you'd pay 20% of the billable rate based on the fee schedule for Medicare. So the deductible could no longer be paid by the Plan F. So actually what it did, it sunsetted. It didn't sunset the Plan F. It didn't eliminate the Plan F. Anybody previously that was turning 65 prior to January 1st of 2020 is still eligible to actually enroll into a Medicare Plan F. Now, the Medicare Plan F, because they are no longer being blocked out as new books of business, what we found is the Plan F premiums a lot of times are higher. But we actually have clients that call in that are maybe in their 80s and they've had a Plan F, and they're like, hey, I have a Plan F and I want another Plan F. I just want a lower premium. And we'll price quote that person and actually be able to enroll them into a Plan F and keep them on a Medicare Plan F, because their 65th birthday happened prior to January 1st of 2020. So what happens to everyone from January 1st, 2020 and beyond? Well, that's a great question. What has happened now is the Plan F has basically been sunsetted for those people. You can't enroll into a Plan F. You can only qualify for one of the other 10 plans. So what did most people do in that situation? Well, most of our clients that did a Plan F previously would want a Plan G. The difference in the Plan F and the Plan G, the only difference is the Plan G requires the person to pay their Part B deductible. So you'd pay your Part B deductible based on the year. And then like right now, that deductible, it goes up every year based on the cost of living adjustment. So depending on what year you're in, you pay your Part B deductible, and then the 20% billable items that are above the Part B deductible is paid 100% by the Plan G supplement. So the Plan F would cover 100% of everything, including the Part B deductible. The Plan G requires you to pay the Part B deductible, which is typically right now it's less than $300 for the year. So it's an annual deductible. You pay it, and then 100% of everything for Part A services, which is anything dealing with the hospital. If you go in the hospital, it's covered 100%. If you're outside of the hospital, it falls under Part B, outpatient services, and that's going to be covered 100% once you meet the Part B deductible for your year. So what did MACRA actually do? It actually eliminated Plan Fs from paying for the Part B deductible. It required Part B deductibles to be the responsibility of the Medicare beneficiary. Therefore, Plan Gs met that criteria of MACRA, and you're able to enroll. So anybody prior to January 1st of 2020 can still enroll into a Plan F. If you have a Plan F and you love your Plan F, even though the premium may be higher, you can maintain and keep that Plan F. Anybody that's born or 65 years of age from January 1st, 2020 and beyond will not qualify for a Plan F. So if you have had a parent that is 85 years of age, and let's say you're turning 65 years of age and they had you at 20 years of age, and you're turning 65 and you want a Plan F because mom and dad has had a Plan F, you would not qualify for a Plan F. You would qualify for one of the other 10 plans as a Medicare Supplement plan. And I would encourage you, if you want the equivalent to that, would be a Plan G. So the Plan G is that. The other option a lot of people are looking at now is a Plan N. The only difference in the Plan N and G, you still pay the Part B deductible, but then you're going to have some small copays, up to a $20 copay when you go to the doctor, up to a $50 copay if you have an ER visit. So very similar in how the coverage works. You can dive into one of our other YouTube videos that we have about the Medicare Supplement plans. And guys, if you're confused still about what options you have when it comes to a Medicare Supplement plan, maybe you don't have a licensed agent that's a professional to guide you through the options, we'd love to be able to schedule a call with you. You can click below, schedule a time. We'd love to be able to guide you through to make your life easy by making Medicare simple. Until next time, I'll see you on the other side.